You may be shocked to learn that a drink often promoted as a miracle cure for health could actually put older adults at risk of a deadly brain bleed. Yes, I'm talking about kombucha, the fermented tea sold in supermarkets and gyms everywhere, widely believed to detox the body, boost immunity, and improve digestion. The truth is, for younger and healthy people, kombucha may be relatively harmless. But for those over 60, especially anyone taking blood thinners, this drink can carry serious dangers. Research and clinical case reports have shown that kombucha can interfere with the way certain medications work, destabilize blood pressure, and in some cases has even been linked to brain hemorrhage. In today's video, I'll be speaking to you as a neurologist, guiding you through 5 key points. The real truth behind kombucha, 3 dangerous ways it can directly affect the brain, the high-risk groups who need to be most cautious, and the safe practices you absolutely need to know. Before we get started, if brain health matters to you, make sure to like this video, share it with friends your age, and subscribe to the channel so you never miss important medical alerts. Your support is what motivates me to keep bringing you valuable health insights. In recent years, kombucha has been hailed as a rising star in the world of so-called healthy drinks. At the supermarket, it is easy to spot those colorful bottles with bright labels promising all kinds of benefits boosting immunity, improving digestion, and in some cases even rejuvenating the body. With promises like these, it's no surprise that many older adults believe that drinking kombucha every day is a way to invest in their health. But the truth is much more complicated. Kombucha is not just flavored water. It is fermented tea brewed with a living mixture of bacteria and yeast known as a SCOBY, short for symbiotic culture of bacteria and yeast. During fermentation, the sugar in the tea is converted into acids, carbon dioxide, and even ethanol, which is alcohol. This means that every bottle of kombucha contains a mix of organic acids, yeasts, bacteria, tea polyphenols, and a measurable amount of ethanol. What makes kombucha appealing is its probiotics, the good bacteria similar to those found in yogurt, often praised for supporting gut health. But what many people overlook is how unpredictable kombucha really is. Ethanol levels can vary widely. Some of the organic acids it produces may be helpful, while others can build up and become harmful, and not every strain of bacteria in kombucha is necessarily friendly to an older body. Another important reality is that kombucha made in industrial facilities may be subject to some safety controls, but many batches brewed at home lack hygiene standards or proper testing. A healthy young adult might tolerate this without incident. But for older adults whose immune systems are weaker and whose liver and kidneys are no longer as efficient, even small changes in what's inside the bottle can pose significant risks. This is where the danger lies. Kombucha is a complex biological product, not a harmless flavored water. After 60, the body loses much of its ability to process these added burdens. The liver has to handle extra ethanol, the kidneys must filter more acids, and the blood vessels need to adapt to shifts in blood pressure and circulation. If you are also taking blood thinners or living with chronic conditions, kombucha can tip the balance from safe to dangerous. Medical literature has documented real cases, people who developed liver toxicity, metabolic acidosis, swings in blood pressure, and in rare cases, even death after drinking homemade kombucha. While these events are uncommon, they prove that kombucha is not the completely harmless drink that marketing suggests. For older adults, the margin of safety is always smaller, and the potential for harm is much greater. So in the end, kombucha may be advertised as a modern-day miracle drink, but in reality it carries no small amount of risk, especially after 60. It is like a double-edged sword. It may offer a modest benefit for the gut, but it can also trigger serious complications for the brain, the cardiovascular system, and the liver. That is why we need to approach kombucha with clear eyes, not just be swayed by glossy labels and glowing promises. One of the greatest dangers when older adults drink kombucha regularly lies in its interaction with blood-thinning medications. After 60, many people are prescribed drugs such as warfarin apixaban, rivaroxaban, or dabigatran to prevent clots that could block an artery and cause a stroke. These medicines play an important role by making the blood just a little thinner so it flows smoothly without forming unwanted clots. But because of that, any factor that intensifies their effect can make the blood too thin, leading to internal bleeding, the most dangerous of which is bleeding inside the brain. The concern is that kombucha can interfere with the INR, or International Normalized Ratio, which is used to monitor how thin the blood is in patients taking warfarin. When kombucha is consumed, the polyphenols, organic acids, and even its small amount of ethanol can alter how the liver processes the drug, causing the INR to fluctuate unpredictably. That means the very same medication dose you take every day could suddenly thin your blood far more than intended once kombucha is added. And that greatly raises the risk of a brain hemorrhage. There are already clinical reports describing older patients on warfarin who developed gastrointestinal bleeding and even brain hemorrhage after introducing kombucha into their daily routine. This is no longer just a theoretical concern. These are documented cases in medical records. To picture this more clearly, think of the body as a plumbing system. Blood thinners are like valves that keep water flowing smoothly without blockages. But when kombucha comes in acting like an extra pressure adjustment, the flow can suddenly surge, causing the pipe to burst. In this case, the pipe is a fragile blood vessel inside the brain. A vessel that ruptures can cause a brain bleed, leading to paralysis on one side of the body, slurred speech, and in the worst cases, death if emergency care is not provided in time. What makes this even more concerning is the sense of false security. Many people assume kombucha is just fermented tea and could not possibly interfere with a strong drug like warfarin. In reality, because kombucha contains a mix of biologically active compounds, it can easily disrupt the way the liver metabolizes these medications. That means all the careful adjustments your doctor has made to balance your blood thinner dose can be undone in an instant. The key takeaway here is simple but critical if you are on blood thinners. Introducing any type of fermented product, especially kombucha, should only be done under medical supervision. Taking it on your own can cause your INR to swing out of range, something you cannot feel or detect until complications have already begun. A sudden severe headache, unusual dizziness, or even a minor fall could then trigger a life-threatening brain bleed. In summary, the first mechanism that makes kombucha dangerous for older adults is its ability to interact with blood thinners. It can thin the blood beyond safe limits, disrupt the delicate balance your doctor has worked hard to maintain, and ultimately lead to brain hemorrhage, a medical crisis that can rob you of mobility, speech, or even life itself within moments. When people think about kombucha, few realize that this amber-colored drink actually contains alcohol. During fermentation, the yeast and bacteria in the SCOBY convert sugar into organic acids, carbon dioxide, and ethanol. Depending on how long it ferments and how it is stored, the ethanol content can range from about 0.5% to over 2%. With homemade kombucha, the level can sometimes be even higher than what a label might suggest. For young and healthy individuals, this small amount of ethanol may not produce noticeable effects. But for those over 60, especially people living with heart disease, liver problems, or who are taking medication, even a small amount can be the drop that spills the cup. That is because ethanol doesn't just burden the liver, it also directly influences blood pressure and heart rhythm. In some people, drinking kombucha can cause a temporary drop in blood pressure, leaving them dizzy, lightheaded, and more likely to fall. In others, it may trigger the opposite reaction, increasing heart rate and causing palpitations. For older adults whose blood vessels are less elastic, these swings are not harmless. They increase the risk of transient ischemic attacks, can promote clot formation, or in other cases, may cause a weak vessel to rupture. Ethanol also puts extra strain on the liver, an organ whose function naturally declines with age. Under normal circumstances, the liver can handle small amounts of alcohol, but in someone over 60, especially with fatty liver, hepatitis, or cirrhosis, this ability is greatly reduced. When kombucha is consumed daily, ethanol can accumulate, further damaging the liver and disrupting the way medications are processed. And as we discussed earlier, when the liver can no longer metabolize blood thinners predictably, the risk of brain hemorrhage rises dramatically. Beyond ethanol, kombucha contains many other biological compounds such as lactic acid, acetic acid, catechins, and flavonoids from tea. Some of these may have benefits, but in higher concentrations, especially when the body is weakened, they can irritate the stomach, alter blood pH, and in severe cases lead to metabolic acidosis. There are documented reports of people hospitalized with serious acidosis after drinking kombucha. Think of the body like an aging electrical system. Ethanol and the acids in kombucha act like unstable currents, sometimes surging, sometimes dropping. With old wiring, which in this case represents aging blood vessels and the liver after 60, those fluctuations can trigger sparks, shorts, and breakdowns. The consequences can be liver failure, irregular heartbeats, or even stroke. What is most concerning is how kombucha is often marketed as a detox drink for the liver. Many believe it helps cleanse the body, when in reality, the liver has to work even harder to process the ethanol and acids from the drink itself. For younger adults, the body may compensate, but for someone older, this is like forcing a worn-out car engine to carry an extra heavy load. In summary, the second dangerous mechanism of kombucha lies in the ethanol and biological byproducts created during fermentation. These substances can destabilize blood pressure, disrupt heart rhythm, and place added strain on the liver. Together, these factors significantly raise the risk of brain hemorrhage or other serious cardiovascular events. While the first two mechanisms involve medication interactions and ethanol, the third danger comes from the way kombucha itself is made. Kombucha is fermented tea, which means it requires time to brew with a SCOBY, a tea mushroom made of yeast and bacteria sitting in a warm, sugar-rich environment. Unfortunately, this is also the perfect condition for harmful bacteria, molds, and even toxins to grow if hygiene is not carefully maintained. In industrial production, beverage companies use sterilization, controlled processes, and testing to reduce this risk. But in many households, kombucha is brewed in glass jars on the kitchen counter, covered only with a cloth instead of a sealed lid. Shifts in temperature and humidity, along with equipment that isn't completely clean, open the door for contamination. The result is that instead of a healthy drink, you may be consuming a cocktail of unsafe microbes. Medical literature has already reported cases of people who drank homemade kombucha and developed acute hepatitis, liver failure, severe metabolic acidosis, and even death. In some instances, patients over 60 were admitted to hospitals with fatigue, nausea, and shortness of breath, only for doctors to trace the cause back to toxins produced in improperly brewed kombucha. Older adults, whose immune systems are already weaker, are much more vulnerable to infection. If they drink contaminated kombucha, the risk of severe infections, sepsis, or liver damage is far higher. This is particularly dangerous because the liver is directly involved in producing clotting factors. When the liver fails, the blood's ability to clot is disrupted, and the likelihood of a brain bleed increases dramatically. It isn't only bacteria that are the problem. Molds can also appear in homemade kombucha. Some molds release aflatoxins, which directly damage the liver and can even promote liver cancer. Younger people might be able to process and eliminate small amounts of these toxins, but older adults cannot. Even minimal exposure can create a heavy burden, causing hepatitis, liver cell damage, and a cascade of further complications. Think about it this way: you believe you are drinking a detox miracle, but in reality, you may be introducing dangerous bacteria and toxins that your liver has to struggle to process. This isn't simply a case of kombucha losing its benefits. It can actively cause harm, turning expected wellness into hidden danger. What makes this risk especially concerning is how hard it is to detect. Contaminated kombucha does not always taste or smell very different. It may still be tart and fizzy, yet contain dangerous pathogens. By the time someone experiences nausea, stomach pain, dizziness, or jaundice, the damage may already be severe. In short, the third dangerous mechanism of kombucha comes from homemade brewing without strict hygiene. Bacterial contamination, mold, and toxins can all end up in a drink that appears to be good for health. For older adults, this risk is real because their bodies are weaker, their liver and kidneys are less resilient, and their ability to tolerate toxins is much lower than in younger years. After looking at the three major dangers of kombucha from its interaction with blood thinners, to the effects of ethanol and biological compounds, to the contamination risks of homemade brews, the next question is, who really needs to be most cautious with this drink? The first and highest risk group is older adults taking blood thinning medications. As we have discussed, kombucha can cause large swings in the INR, the measurement used to monitor blood clotting. This can push the blood past safe limits, raising the chance of a brain bleed. For anyone on warfarin or DOACs, drinking kombucha without medical supervision is like putting yourself directly into harm's way. The second group includes those living with chronic liver, kidney, or cardiovascular conditions. A weakened liver cannot effectively process ethanol and organic acids. Damaged kidneys struggle to filter out oxalates and toxins, and fragile blood vessels are less able to withstand the pressure changes kombucha may trigger. Combined, these stresses can push the body out of balance and cause serious complications. The third group is anyone brewing kombucha at home. As explained earlier, the risks of bacterial contamination, mold, and toxins are real. A younger person might recover after a few days of discomfort, but for someone over 60 with a weaker immune system, the consequences can be far more severe, from acute hepatitis to sepsis. So what are the practical safety steps I want to share with you? The most important advice is this: if you are over 60 and on blood thinners, avoid kombucha completely. There is no safe margin with this combination. Even small shifts in INR can have devastating outcomes. For those who still want to try kombucha out of curiosity or habit, only choose products from industrial production with clear labeling. Never homemade versions. Start with very small amounts and pay close attention to how your body reacts. But the wisest step is always to consult your physician, who knows your health history and medications, before making kombucha part of your routine. Also, be alert to warning signs. If, after drinking kombucha, you experience a severe headache, dizziness, nausea, vomiting, blurred vision, or sudden weakness in an arm or leg, treat it as an emergency. These may be symptoms of a brain bleed or neurological complication that requires immediate medical care. And don't forget, the benefits that kombucha companies advertise, like better digestion, can be achieved through safer options for older adults, such as low-fat yogurt, tested kefir, or simply a diet rich in fiber from fruits and vegetables. These choices are gentler, safer, and do not come with the risk of brain hemorrhage. In short, kombucha is not a drink for everyone. For younger people, it may be part of a wellness trend. But for those over 60, especially with health conditions and on blood thinners, kombucha can be a hidden trap. Identifying who is at risk, understanding how kombucha can cause harm, and turning to safer alternatives are the smartest ways to protect both your brain and your overall health. We have just taken a careful look at the hidden risks kombucha poses for older adults. In the first point, I emphasized that kombucha, though often promoted as a healthy drink, actually carries dangers that are rarely noticed. In the second point, we saw the first mechanism kombucha interferes with blood thinners, making the blood dangerously thin and opening the door to brain hemorrhage. In the third point, ethanol and other byproducts of fermentation were shown to cause blood pressure swings, place extra strain on the liver, and trigger irregular heart rhythms. The fourth point warned about bacterial contamination, mold, and toxins in homemade kombucha, which is especially risky when the immune system and the liver and kidneys of someone over 60 are already weakened. And finally, the fifth point identified the groups most at risk: older adults on anticoagulants, those with liver, kidney, or heart disease, while also sharing safety advice, from avoiding kombucha altogether, to recognizing early warning signs, to choosing healthier substitutes. The key message to remember is this kombucha may be harmless for younger people, but for those over 60, especially with underlying conditions, it can act as a hidden threat to the brain and even to life itself. A glass of kombucha that seems harmless can interfere with medications, overload the liver, or introduce dangerous bacteria and toxins. The end result may be an unexpected brain bleed. That is why, instead of chasing a trend, it is wiser to choose foods that are safe, evidence-based, and truly appropriate for older adults. A diet rich in vegetables, fresh fruit, low-fat yogurt, or certified kefir can bring the same digestive and immune benefits without the trade-off of a stroke risk. If you found this content helpful, please give this video a like, share it with friends in your age group, and don't forget to subscribe so we can continue this journey together. Every small click from you is encouragement for me to keep bringing you medical information that is clear, easy to understand, and practical for your daily life.